Good afternoon. My name is Filiou. I'm a psychologist and a PhD candidate in the University of Macedonia. I'm also a member of Lab Autism. First of all, I want to thank Professor Siriopoulou for this opportunity to present parent counseling and other interventions to support parents of preschool children with autism spectrum disorders. First of all, I want to present a specific program named Parent Schools based on Cognitive and Behavioral Therapy, or CBT, to support parents. A cognitive model based on three stuff, thoughts, emotions, and behavior. So the way we are thinking affects the way we are feeling and our behavior. This program is an intervention for parents, parent schools, intervention with the children of the family, support in the context of prevention and immediate intervention. This program focuses on parent education first and secondly, the child. Parent school. Parent schools are training programs aimed at parents or parents-to-be or any person entrusted with the care and education of the child, providing additional insights into the family, parent, and child rearing. The main objective is to changing the attitude and behavior of parents towards handling everyday difficult situations with themselves and their children. Difficult daily situations due to the modern way of life make it necessary to prepare the parents. A few words about the program. It is aimed at parents of children aged 3 to 6 years old. The participants can be 8 to 10 parents. The duration of this program is 10 to 12 meetings. Training and education of parents, this is the main content. Application of cognitive and behavioral techniques. Parents have some expectations of this program. The expectations focus on to learn about mental development and the stages of child development, the child's psychology, for activities that help the child's development, how they can relax and communicate with the child, and on the utility of reinforcement and punishment. Finally, for how they can help the child on an emotional, social, and behavioral level. Some CBT techniques in these parent schools, we can use some techniques in order to educate or train parents in these schools, such as psychoeducation, in order to educate parents for the symptoms of child, and normalize the symptoms. Socratic dialogue, in order to have a dialogue with their children. Cognitive model, like thoughts, emotions, and behavior. Problem solving, this is a technique focused on problem management step by step. Another CBT technique is classical conditioning learning, operant conditioning learning, model imitation, enhancement, punishment, role-playing. Another technique that we can teach parents are coupon technique, a technique based in reinforcement, training in basic emotions such as joy, sadness, anger, fear, anxiety, negative automatic thoughts, cognitive errors, confidence technique of disarmament. And now I will focus on in the behavior therapy in children with ACD. And how can we teach parents and training parents who have a child with aggressive behavior. First of all, in order to consider a child's behavior pathological, it is necessary to have a long duration to manifest itself over a long period of time, have a high frequency to occur very often, have a high intensity, his symptoms are intense, and to be dysfunctional for the life of the child and his environment. So, aggressive challenging behavior. It is conduct of such intensity, frequency, or duration that the physical safety of the individual or others is likely to be seriously and engaged, or conduct that may seriously limit or preclude access to and use of ordinary social facilities. Varies from one environment to another, like in definition, recognition, and treatment. Several challenging behaviors exhibit or include or are characterized by physical violence, destructiveness, self-injury, unbridled rage, antisocial behavior, and indecent sexual behavior. So, some CBT techniques may be recording child's behavior via questionnaires and a diary, psychoeducation, boundaries or rules, child boundaries of course, emotions, relaxation techniques like diaphragmatic breathing, progressive muscle relaxation, and role playing. And now, this is an example of a diary, but I think that it's not so clear. Yes, maybe the letters. Okay, I will pass it. So, another CBT technique is a systemic desensitization, behavior exposure, exposure to imagination, reinforcement and punishment, token technique, play therapy, exercises for expressing and managing emotion, like anger thermometer, and different activities such as painting. Finally, time-out technique. Thank you very much.